Hi, I'm Dr. Steve Davis. I'm the Medical Director at the Dermatology and Laser Center in San Antonio. We do a lot of skin cancer surgery here. In fact, in my career, I've probably done at least 25,000 different skin cancer operations. So surgery for skin cancer is still a primary way to treat that disorder, and there are a lot of good ways to do it. Sometimes, however, it can be difficult to do a skin cancer procedure on a given patient because of the patient's limitations. For example, people on blood thinners, people who have diabetes and might not heal well, an older patient doing a big skin cancer on the scalp or on the ear, it might be difficult for it to heal. In the past, we've done that anyway. We've gone ahead and just done the best we could with it, and usually we get good results, but it can be difficult for the patient to go through all that. In the last 10 years or so, a number of FDA-approved devices that deliver superficial radiation for skin cancers have been popping up on the American landscape. And there are a handful of dermatologists here in San Antonio who have that kind of device. When I decided that this would fit my practice particularly well, I found a device from a company in the United Kingdom called Xstrahl, which makes a lot of these bigger devices in Europe, and now has come up with what I think is a very good radiation treatment device for the dermatology office. My particular machine delivers different types of modes of superficial radiation treatment, and whereas in the past it might have taken 30 or more treatments in a standard radiation oncology center to treat a patient with skin cancer, it's now come way down to where now many of our skin cancers can be treated with 8 to 12 treatments, twice weekly for 4, 5, 6 weeks with very good results. The use of radiation in a dermatology office is very different than that in a radiation treatment center. We don't use radioisotopes in our machine. There's no radioactive material. It's all delivered electronically. The photons only go a fraction of a distance into the skin. It can go right on the surface, or half a millimeter, or a millimeter and a half. So very quickly that energy is dissipated. So we don't have the same overall requirements that a major radiation oncology center has. We do track and monitor radiation levels, and we have all kinds of signs up. We've reinforced the room some. We have a lead-lined door in place, and the control center for all this is a monitor that we use to track. The software tracks all the information on the patient, what we call the simulation, which is the treatment plan, how many treatments the patient has had, how much radiation they get per treatment. So it's really a great piece of software, and once we get it set up, it can't be changed without a total reevaluation of the patient. This is my Xstrahl Radiant device. I like it because it's small, it's mobile, and there's not a lot of different things you have to place on the patient, no big accessories to place. You simply place this on the patient's skin, and Stephanie, my PA, will show you how all this is done in a few minutes. And this is the whole device, and it's remarkable that we can do all this with just this particular device. And each treatment only takes about a minute to 2 minutes long. They're totally painless, there's no blood involved. And even though the patient has to come in multiple times, for some people who have problems with bleeding or problems with healing, or maybe it's on the lower leg where it would be very difficult for it to heal, they have hypertension, they're older patients, this could be a very good treatment option.
So this is our Xstrahl Radiant radiation machine that does superficial radiation and electronic radiotherapy. So both of those settings we use for patients depending on the tumor type and location. The treatment itself, patients can be expected to be in the office for about 15 minutes. They'll come in, we'll get them positioned and ready for treatment. The area will be marked by Dr. Davis and outlined with the target area to be treated. Once the patient has been positioned, the cone that sits on the end of the radiation machine will be placed flat against the skin. Once the cone has been placed on the patient's skin, Dr. Davis will administer the radiation treatment. The treatments generally last from about a minute to 2 minutes. While the treatment's being delivered, we monitor the patient with video and audio streaming to ensure that the machine has not moved and the patient has not moved during treatment. After their treatment, we remove the markings that we placed on the side of the treatment site, and the patient is on their way to enjoy the rest of their day.
Well, I hope you've enjoyed the tour of our facility. We're very proud of what we can do. And like I said, it's not for everyone. People have to meet certain indications and criteria. It is reimbursable by insurance for those people who qualify. So if you think you might qualify for this type of treatment and prefer it, you can get in touch with us here at the Dermatology and Laser Center of San Antonio.